The IT band is a band of tissue that is an extension of your TFL, the hip flexor muscle right here, and it goes as an extension down the side of the upper leg, down the side of the thigh, and then attaches in to your knee and actually kind of continues along the side of your leg. But the portion we're focused on is what's called the IT band, which is between the hip and the knee. And it's, I'm gonna go through a special video on this one, not just including it in the quad, because you need to kind of position yourself in a different way than you would with the quad. Now, I'm not gonna sugarcoat it. This is gonna probably be tender. It's gonna hurt, especially if you've never done this before. It may hurt a lot, so you're gonna wanna use your softest roller. But yeah, we're just gonna have to cowboy up here. So what you're gonna do is position yourself like this with a lot of points of contact. Notice I have forearm and hand on the side that I'm working on. I have this other hand. I have this foot I'm not working on up in this tailor position to help support myself. And this is what you're gonna want in the very beginning, or if you have a lot of tension here, because you want to deload some of your body weight, and you also don't wanna be working hard just having like one arm support you the whole time, okay? You wanna be able to relax through this. So as we do, we begin with quick movement, just sawing in little 2-inch swaths and moving our way down to the knee. Now, if I want to add more tension on this because I'm comfortable with it, I can stack my legs, and now there's far more pressure into the roller. That's creating a deeper release once I'm ready for it. If I need to give myself more help, I'll bring this foot further and further up where I deload more of myself and give myself some more help. And I'm just going to keep moving here, breathing, long exhales through the mouth, and work my way all the way down to the knee and then all the way up to the hip. Okay, and then we're gonna go through our slower, more methodical exploration, and that's where we're gonna hunt and find spots like that one that really sucked, that hurt a lot, or maybe where the tissue is hard or gristly or just doesn't feel as healthy and supple as the rest of the tissue. And we're gonna take breaths here, 3 to maybe 10 breaths if you got some time. Okay, we're gonna also use our focus to try to soften the face, soften the body, soften the area that we're on. So we're trying to willfully soften and relax this tissue. And then we're also gonna cross fiber, which means that I am moving my body front to back here so that the tool, the implement I'm using, can saw against the grain of the tissue, across the tissue. So the fibers of the IT band move from the hip vertically down to the knee. So if I have an implement, I hunt along the way the fibers grow, and then I'm gonna saw sideways here to use that as a tactic to stimulate release, relaxation, and change in the tissue. And then we're gonna work our way all the way down to the knee, and we're gonna come all the way back up. We can also use that poor man's ART trick that you've maybe seen me do if this isn't your first video on self-massage and release work, where I'm going to flex the knee. We're gonna do it slowly at first and extend. Flex the knee as much as you can and extend. Flex the knee, try to stay relaxed and extend. Do your breathing. Exhale through the parts that are the most uncomfortable. And there you go. Now, one other thing you can get here that I like to do while I'm doing my IT band is this band of tissue, this tendon right here that goes up into it is an extension of the hamstring, where one of the heads of the hamstring attaches down to the lateral portion of the knee here. Hopefully you can kind of see that band. So while I'm on the IT band, I can get into this tendon right here that is also a little tender and needs some work. So if I'm totally on my side for the IT band, all I'll do is maybe just rotate, put this non-working leg behind me, and now I can get right on that tendon, right at the knee, literally right where at the tibial tuberosity here, this bumpy, bony protrusion where all this tissue comes in and attaches. I can get right on top of that and do some work on that tendon, and then work my way up where I'm getting the kind of back portion of the IT band and some hamstring work there. And there you go, that's your IT band release. Start with a soft roller if it's your first time doing it, and as always, just make sure that you're working through the full length of the tissue, not just staying in one part, okay? So just be systematic about it and breathe through it, try to relax, and just know that the more that you do this, the less it hurts and the better you get at softening. Softening is a skill just as much as creating tension is, all right? Get to it and then do the other side and move on to the next video.